Your lie-on is quite hard. You'll have a cushion under your head, under your knees and under your feet. These will stay the same every day for your treatment. They're used to replicate your position. If you're uncomfortable, let us know, because there are some things we can do, but we need to know before you have your scan. After the CT scan, you'll be given some permanent radiotherapy tattoo dots. They are very tiny. You might not be able to see them, but they'll definitely be there. The tattoo dots shouldn't hurt. You'll just feel a sharp scratch while they're being done.
On the CT scans where they put the implant or check the implants and put your tattoos on, they also do an ultrasound on your bladder to make sure that your bladder is actually full while they're doing it.
We use the tattoo dots in the treatment rooms. We have some lasers that come out of the wall which we use to put the centre of the lasers in line with your tattoo dots, and this is so we know we're treating the right area.
Before we deliver a radiotherapy treatment, a patient will have an X-ray taken. That allows us to be able to match the patient's position with their CT scan to the patient's position for each day's treatment. This allows us then to compare the two positions for the gold seeds, and the difference between them allows us to adjust for their position each day.
As you are entering into the treatment room, we will be asking you to confirm your name and date of birth. This is because we want to make sure that we are taking the right patient through, and also we want to verify we are holding the right paperwork in our hand. We ask you to remove your shoes and your trousers. You're absolutely fine to wear anything on your top. We ask you to leave your underpants on. If you are wearing a metal bed, we can't see the fiducial marker where we want to focus on. That's the reason we don't want any metal part in that region.
And you lay on the table, pull your underpants down to just a decent level, lift your shirt up, and they then manoeuvre you on the table to line up on the XY and the centre lines to get your body in the same position every time for when you have your treatment.
Once you lie down on the bed, what you need to do is you need to keep still but breathe normally during your positioning as well as your treatment. You don't need to hold your breath for this particular treatment.
It's all mechanical, it's very smooth. You're raised up into the air, and you hardly even know it's moving. You know, you're laying on the bed and somebody speaks at your ear and you look to the side and the nurse's head is level with you, so you've gone up in the air, but you don't really feel it, or I don't feel it even moving.
You'll be hearing us reading some numbers. Ignore the number again. This is a technical number we are reading from your paperwork. Basically, from the marker we are moving the couch or the bed to where we want to treat.
They explain what they're doing. They're lining you up on your tattoo marks. Some arms that come out on the machine that are like X-ray arms. They take an X-ray or a picture of where you are, and if they have to adjust the bed for the machine and your implants, then the bed will adjust itself. I can't feel anything. You can hear a few buzzes and noises.
So you need to be in the treatment position for approximately 15 minutes. However, the actual treatment will last approximately 2 minutes. This treatment itself, absolutely painless treatment. You won't feel or sense anything. You may hear some buzzing noise as the treatment gets delivered. Apart from that, you wouldn't notice anything. The treatment time as well as treatment dose remain exactly the same throughout your course of your treatment. There is no change in that one. So from day one till end of your treatment, same amount of treatment dose as well as same amount of treatment time will be taken.
Radiographer doesn't stay in the room. They all leave the room. They press the last man out button that gives a siren warning, and they all leave and they don't return until the treatment's finished. If you're uncomfortable or you can't, something's not quite right, you can raise your arm and they can see you on camera and they will stop the treatment and come back in.
After treatment, you're not going to be radioactive, so you're absolutely fine to move ahead with your social life and you can spend time with your family.
We like to see patients about midway through their treatment. We discuss any side effects or symptoms that might be occurring. And we also like to see you at the end of your radiotherapy to talk about what to expect following your treatment and discuss any symptoms or side effects. We often give patients a pre-appointment questionnaire which identifies any toxicities which might be occurring during the treatment. The radiographer may give you this the day before and then we'll discuss any concerns that are highlighted.
You do get a questionnaire which is a tick box questionnaire, And yes, she ran through all the how I was feeling, how my bladder was, my bowel, if I got any problems, etc., which I discussed with her.
The common side effects from radiotherapy treatment of the prostate can include altered bowel habits. You might be more looser or constipated. You might also experience sensitive bladder with urine symptoms of frequency, urgency, or stinging or burning. Your skin might feel more sensitive in the radiotherapy treatment area. We recommend you use a basic moisturiser. You may notice that you feel quite tired and fatigued during your radiotherapy treatment. We do advise that you take rest as needed and plan your activities around your energy levels. If you're experiencing blood in your urine or unable to pass urine or extreme pain, we need to know immediately so that we can help you. These symptoms are quite uncommon, but if you let us know of any concerns or symptoms, we can give you advice.
Basically, everything has worked out as the oncologist described to me how the treatment would be, how long it would take, the number of weeks it would go on for. Everybody really is kind and treats you really well. You feel like you're in good hands. The system runs very smoothly and no problems whatsoever. My tip is just carry on as normal. Do whatever you normally